Hello everyone, how are you today? I hope you are in good condition. First, I want to introduce my group. We are from group 5, which consists of me, Puput, Hanifah, Nuranisa, Syarifah, Syila, Alkadrie, Antya, Alhikmah, Alham, Siti, Nurcholisah, Rizky, and Ananda, Aprilia. Here, our group will discuss a topic that often occurs in teenagers. The topic that will be discussed by our group is about mental health issue. So, our group made 4 outlines which will be discussed consisting of what is a mental health issue, what mental health issues are often experienced by us as students, how do we deal with mental health issue, why should we take care of mental health. Okay, without further ado, let's move on to the discussion. So here, do you already know for sure what is a mental health issue? Before going to the meaning of mental health issue, it is necessary to first know the meaning of mental health. Mental is things related to the mind and human nature. In other words, a mental health issue is condition when the human mind and character are in normal, peaceful, and calm state, so that they can carry out activities and enjoy daily life. Mental health, according to WHO, is a state in which a person realizes his abilities, can control the normal stresses of everyday life, can work productively, and is able to contribute to those around him. WHO emphasizes that mental health issue more than the absence of mental disorders, but also the desire to maintain and seek emotional happiness. Mental health is an important component in every level of human life, starting from childhood, adolescence, to adulthood. In fact, it is often mentioned mental condition in childhood can affect a person's mental development in adulthood. So, the meaning of mental health issue is disease that affect the emotion, thought patterns, and behavior of sufferers. As with physical illness, mental health issue also has a cure. Next, Syila will discuss some example of mental health issue that we often experience as a students.
Okay, the next discussion is what mental health issues are often experienced by as a student. The first is self-injury. Self-injury is behavior that hurts or injures oneself that is done intentionally. Self-injury can be in the form of injuring the body with a sharp or blunt object such as cutting or burning the skin, hitting a wall, banging the head, beating oneself, and pulling hair. Self-injury is often done to feign, distract, or overcome excess emotions such as stress, anger, anxiety, sadness, loneliness, hopelessness, numbness, guilt, or self-hatred. This emotion can arise due to several things such as social problems and psychological trauma. Then the characteristics that are often seen for self-injury perpetrators are having a number of wounds on their bodies such as cuts on their wrists. Second is depression. Depression is a mood disorder characterized by deep sadness and loss of interest in popular things. A person is declared depressed if he has felt sad, hopeless, or worthless for 2 weeks. Depression that is allowed to continue and does not get treatment can lead to a decrease in work productivity, disruption of social relations, to the emergence of suicidal ideation. Psychological characteristics of people who experience depression are the emergence of excessive anxiety and worry, unstable emotion, and feeling of hopelessness or frustration. Then the physical characteristics are always feeling tired and powerless, dizziness and pain for no apparent reason, and decreased appetite. This depression can be caused by a traumatic event, mental stress, and wrong mindset. The next discussion will be explained by Antya.
Next, bipolar disorder. Bipolar disorder is a mental disorder that causes changes in mood, energy, activity levels, concentration, and the ability to carry out daily activities. People with bipolar disorder who previously felt very happy can suddenly turn into very sad and hopeless. This is often experienced by several teenagers whose moods like to change, including me. But I don't think it's bipolar disorder because the mood swings in people with bipolar disorder are more significant and their concentration levels are unstable. Eating disorder. Eating disorder is a serious condition associated with eating behaviors that have a negative impact on health, emotions, and ability to perform activities in daily life. One type of eating disorder is an anorexia nervosa. Anorexia nervosa is eating disorder characterized by low body weight and fear of gaining weight. This makes sufferers limit their food intake because they feel they are overweight. Even though, in fact, their bodies are already slim or are too thin. My experience is anorexia nervosa a few months ago. This could happen to me because my weight at that time was too fat for me and I went on an unhealthy diet to be thin. But when I was thin, for me it was nothing, and I continued constantly torturing myself to eat less. So over time I realized it because my parents reminded me that this was not good. Next, Sis Nanda will discuss about how do we deal with mental health problems.
Next, we will discuss ways to deal with mental health problems. There are two ways to deal with mental health problems, namely externally and internally. Ways to deal with mental health externally include: first, psychotherapy. Psychotherapy is a talk therapy for sufferers to express their feelings and ask for advice. The psychiatrist will guide sufferers in controlling feelings. Second, brain stimulation. Brain stimulation is electroconvulsive therapy, experimental treatment called deep brain stimulation, and others. Third, administration of therapy. Medication is generally combined with psychotherapy for more effective results. Fourth, hospitalization. Hospitalization is required if the patient requires close monitoring or is in an emergency department. Fifth, support group. Sufferers come together to share experience and guide another towards recovery. While ways to deal with mental health internally include: first, loving yourself. It is important to learn to love yourself in order to respect yourself and control your emotions. Second, have a healthy lifestyle. Having a healthy lifestyle can prevent chronic and long-term diseases. Examples of doing a healthy lifestyle include having a positive attitude, maintaining a regular exercise routine, and consuming good nutrition. Third, express yourself. Practicing self-expression is important for building self-confidence and releasing emotion. Last, make a plan for yourself. For example, managing lifestyle and daily habits to fight mental illness. This plan aims to monitor health, assist in the recovery process, and identify triggers or warning signs of illness. The next discussion, it will be explained by Siti Nurcholisah.
Next discussion about why should we take care of mental health. Maintaining mental health is very important because mental health can affect daily activities. Good mental health is a condition one's mind is a calm state so that one can enjoy everyday life. On the other hand, people whose mental health is disturbed will experience mood disorder, thinking skill, unstable emotion, often feel tired, bored, dizzy, cannot socialize properly, and they ultimately lead to behavior. For that, everyone must understand the importance of maintaining mental health. Good mental health is essentially able to create a positive outcome. Besides, the mental health is also related to physical health. Good mental health makes a person think well, resulting in the more focus and attention. People who have poor mental health are usually difficult to focus and easily distracted. It's important for a person to have a healthy mentally from a young age. By having a healthy mentally, a person can feel various benefits in carrying out his life, such as: first, better able to cope with the stress and pressure of life. Second, can establish good relationship with fellow human beings. And the last, be aware of your potential.
That's all from Group 5. I would like to apologize if there are any mistakes. Thank you so much for watching. I hope it's useful. I hope you have a nice day. Bye.